Because you're having a general anaesthetic, you fast the night before. They did send home a scrub pack, and I was to scrub the area around my knee with the scrub packs provided 3 nights in a row. I needed to pack some clothes, the medications I usually take, and also make arrangements to support my family while I was in hospital.
You're a little anxious, I suppose. You're sort of in a little enclosed area. You're not put into your room until after the event. And you're just one of many people there. But again, the attention that you're given is very, very good, and anything you need or want.
Well, the anaesthetist came in first and spoke to me and how are you and all that, and then just sort of asked you general questions about are you allergic to this or that. And then the surgeon came in, how do you feel? You know, you ready? Yeah, okay. And then the next thing you know, they put the little needle in your hand and count backwards from 10, and by the time you get to about 8, that's the last thing you remember.
Next thing I know, it's 9 p.m. at night, and it's all over, and I'm back in my private room.
It was painful, very. You can barely move, or if you attempt to move, you can't. You are trussed up with everything. You're connected to everything still, but it's a pain you can endure with the help of medication. It's okay.
My knees weren't sore at all. Nothing, that wasn't sore. I think I was more or less, I didn't feel well. That's probably after the operation. You feel a bit ill and you've been through a bit of a turmoil. When they finally take you off all the medication after the operation, which is about the 2nd or 3rd day, that's a bit of a harrowing day to spend. They get you back onto tablets to ease your pain and so on. Yeah, that's probably the worst part of it.
I had a spinal block, and then I had the general anaesthetic as well. And from that day till the day I was discharged 2 weeks later, I did not have any pain at all.
And they do try and get you to move pretty much straight away. And you have great difficulty, probably because it's in your head. I can't do this. And they just simply get you on your feet, they're hanging on to you. You know that you're in safe hands. You know you're doing okay.
Then finally you get up and you get on a little frame and away you go and do a lap round the room. And then they come in and you have your ice packs and stuff on your knees to try and get the swelling down, because a lot of swelling there to start with.
I think I stayed in the hospital for about 6 or 7 days in the end. A little bit of physio within the hospital system just to make sure that you're getting up and moving. You just got to be positive and go forward and think of the end result.